Hello, welcome back to Vlogmas. What day is it? It's the 6th, Vlogmas day 6. Today I was supposed to be learning K-pop dances with my sister-in-law, but then I realized I had a lot of schoolwork that I technically have to do without having to do. Like, it's optional, but it's best to do it before class starts on the 14th. And knowing me and the fact that it's a lot of reading and I actually have to like learn the things and not just be enthralled in like a story that I usually do, I'm giving myself now until the time. So I'm making flashcards, I'm writing down information, and so this is gonna be like kind of like a school vlog. I have my planner for things that I need to like write down in my planner. I have my 5-subject notebook here that's got like chapter 1 breakdown, so it's chapter 1, 3, something, and 9. I think it's chapter 5 is next. Oh, chapter 1, 3, 4, and 9 is what I need to do right now. What's nice is they have a quick little like thing I can press to go to the vocabulary and key terms, which is on Quizlet, which is really nice. And I'm just kind of like making my own flashcards because it told me that that's best. And also, honestly, if for some reason my Wi-Fi is like bugging out, I now have like the physical versions. Only thing is it's making my hand cramp. But anyways, welcome back to the channel. If you don't know by now, obviously I'm doing Vlogmas / Bookmas. There are going to be some book videos sprinkled in here. And then there's going to be some family vlogs like sprinkled as well, where I'm doing like videos with the kids and whatnot. This is a safe place, so I don't want to see, hear, or read any horrible comments. If I have to turn the comments off, I will. If I have to block a viewer from viewing my stuff, I will, because I believe in the safety of my family and also their mental state. And I don't want any like horrible comments on the videos especially that they're in. I can handle it. I don't want them to have to handle it. But no, now past the bitchiness. Yeah, like I said, it's pretty much just a school thing. So like I have chapter 1 vocabulary and key term flashcards, and like they're multicolored because I kind of ran out of the other color. You're gonna run away? Why? Oh. It's like what involves the diagnosis and treatment of diseases of oral tissue supporting and surrounding the teeth. They are called periodontics or periodontists. I failed that one. It's fine. Directly involved in patient care, and what duties does it include? I just made these guys. Chairside dental assistant duties are charting, placing, and removing rubber dams, passing instruments, mixing and passing dental materials. What was first recognized? Oh, who was first recognized Native American female dentist and when? It's 1950 something. Oh, shoot. 1975, Jessica A. Rickard. I was so far off on that one. That wasn't even funny. Who is the individual who is legally and ultimately responsible for the care of patients and for the supervision of all other members of the team? Dentists. I got that one right. Oh. The dentist trained in the United States must graduate from a dental university approved by the Commissions on Dental Accreditation Coda of, I forgot the E and the, of the American Dental Association, CADA. Depending on which school they attend, when a dentist graduates from a dental university, they are awarded either the blank or blank Doctor of Dental Surgery or Doctor of Medical Dentistry. A Bavarian physicist who discovered the X-ray beam in 1895 it's like Wilhelm Conrad Roentgen. I got the first name. The images produced by X-ray beams on film are known as radiographs. I just forgot the S. New Orleans dentist usually credited with employing the first dental assistant. It's like something Tanner. I'm so far off. See Edmund Kells. This is something Tanner, right? 1867, Harvard University initiated its first dental class and accepted its first African American student. No. It isn't something Tanner. Who is it? It is Robert Tanner Freeman. I fucking knew it. Involves the nature of diseases affecting the oral cavity and adjacent structures. A major function of this dental specialty is to perform biopsies and to work closely with oral surgeons to provide a diagnosis. Oral pathology. Who was the first African American woman in the United States to earn a dental degree? Ida Gray Rollins. Who was the first Native American dentist in the United States and when? George something. 1956, George Blue Spruce Jr. That's the longest name. What involves the diagnosis and surgical treatment of diseases, injuries, and defects of the oral and maxillofacial regions? It involves significantly more than tooth extractions. So, oral and maxillofacial surgery. Wow, that was easy. What uses new and sophisticated imaging techniques to locate tumors and infectious diseases of the jaw, head, and assists in the diagnosis of patients with trauma and temporomandibular disorders? Became the first dental specialty in 36 years when it was granted recognition by the ADA in 1999 in its oral and maxillofacial radiology. What is used when trimming diagnostic casts and studying modules? Model trimmer. Define sterilization assistant. They efficiently and safely process all instruments and manages biohazardous waste. Who serves as an extra pair of hands when needed throughout the clinical areas of the practice? Circulating assistant. Who is responsible for seating and dismissing patients and for preparing and caring for instruments and the treatment rooms? Circulating assistant. What is the room in the dental office that is used by staff to pour impressions, prepare study modules, and polish removal items such as dentures and space maintainers? Dental laboratory. What area contaminated instruments are cleaned, packaged, sterilized, and stored for reuse? Instrument processing area. What involves developing policies at the country, state, and national levels for programs to control and prevent diseases? Example, it included professionals involved with fluoridation, community and oral health education, and Head Start programs. Blank also included dental screenings within community to assess the needs of the community. Oral surgery. Dental public health. I got that right. I'm just kidding. No, I didn't. What involves the diagnosis, treatment, and prevention of malocclusions of the teeth and associated structures? This specialty entails significantly more than fitting of braces, orthodontics, or orthodontists. What are dental treatment rooms? What are dental treatment rooms also known as? Operatories. What involves the oral health care of children from birth to adolescence? Example / hint often treats children with emotional and behavioral problems. Periodontics. Pediatric dentistry. I knew it started with a P, because P for parent. What involves the causes, diagnostics, prevention, and treatment of diseases and injuries of the pulp and associated structures? Root canal treatments. Endodontics or endodontists. Describe dental laboratory technician. Usually does not work in the dental office within the other team members, makes crowns, bridges, and dentures from impressions. What involves the restoration and replacement of natural teeth with artificial constructs, such as crowns, bridges, and dentures? Dental laboratory. I'm just kidding. prosthodontics or prosthodontist. I have no idea. What specialty? Generally removes deposits in the teeth calculus, exposes radiographs, places topical fluoride and dental sealants, and provided patients with home care instructions. In many states, blank are called to administrator local anesthetic. Registered dental hygienist. As you can see, I need to study them. Okay, my student advisor is freaking amazing. I just asked her questions and it's not even been like 5 or 10 minutes and she already got back to me and like answered all 3 of those questions. Also, I feel so bad for her and then also the other person that I've been messaging. I've been like blowing up their phone and emails with a whole bunch of questions. So luckily I only had like 3 questions for her. But no. So yeah, those are all my flashcards. I'm just gonna get back into studying. I'm just getting down kind of chapter 3 breakdown in my notebook. Right now I have that it's about anatomy and physiology. So we name and describe the terms used to designate directions in the body as the planes and sections of the body. And then we list and describe the organizational level of the human body and then name each body system and identify something. Its major functions. By the way, if you don't know, I'm going in to be a dental hygienist. No, a dental assistant. And I'm going to have 2 years under my belt. And then I am going to decide from there if I want to further my schooling and become a dental hygienist or if I want to stick to dental assistant. That is what I'm doing. Okay. Discuss. All done with that. So now we are on to vocabulary and key terms, which then it's going to take me to here, and it's going to give me what is the study of the human body? Anatomy. You know that one. Whatever. And it's going to be anatomy, right? Yeah. Sagittal plane. That is a weird word. I think I'm gonna take a study break and eat some food, and then I'm gonna be back and do more studying. So is Christopher still on break?
He goes back home every Friday and then leaves to go back to school on Monday.
I'm just doing a timeline, like a time lapse. I don't know.
You just have to record all of it.
Yeah.
Is there a reason or just didn't want to?
Huh?
Is there a reason or just didn't want to? Or is you recording?
I'm just recording portions of it. What? Why? Boring. Oh. What the fluff? That is a big ass word. Temporiomandibular.
The heck?
I know. Told you, big ass nerd. I'm a little under halfway there. Through chapter 2. Or chapter 3, I should say. 1, because I have 1, 3, 4, and 9.
So my brain is not working.
Exactly. He's twacking out and not letting me see the flash card. I said he keeps twacking out and not letting me see the flash card. Is that what it is? Study of the human functions. I got it right. A branch of the 5th cranial nerve in the primary source of the nerve supply of the mouth. Aha. Yes. Plane that divides the body into anterior and posterior. Yes. Approximately 75 to 100 trillion cells join together to form special groups known as tissues. Shut up. I got it wrong. So I told it to shut up. I do think that that one was the next one. Who's it? It was. I don't know how to say that word. Cartel. Just kidding. Oh God, what time is it? I got 2 hours until my orientation. What is it called? Something to do with the nose. Yeah, it does say nasal in there. I fucked up another I just straight up majorly spelled that word completely wrong. Did you know that your nostrils can also be defined as foci? You have one foci, two foci.
What even is a phone? What?
A foci is a nostril.
Is it?
It's like a medical term for nostril. Just like this is septum.
That word kind of sounds. Is it a different language?
Maybe.
I don't think it's English.
Fossae. Huh.
It's confusing.
Oh, that's confusing. The part of the mandible that forms a chin is called mental protuberance. Yeah. I don't know, because medical terminology is complicated and stupid. I'm still recording. I'm keeping that in. What is the angle of the mandible? It is the lower posterior of the ramus. Mandible is also a weird word to spell. Done 25 out of 35. No! What is the study of the structure of the human body? Anatomy. Correct. Lower posterior of the ramus. I just did this. Angle of the mandible. Yes. Any vertical plane at right angles with a sagittal plane that horizontally cuts through the body. Transverse plane and horizontal plane located on each side of the head, where the temporal bone and mandible join, make it possible for the lower jaw. It's the temporomandibular joint, the tissue that surround the teeth, commonly referred as the gums. Gingivae. If it starts deteriorating, it's called gingivitis. Flashcards. Go back. Zygomatic arch. Prominence of the cheek. Alright, so my phone's bugging the fuck out. I think I fixed it. I had Google Photos still on my phone, and fuck that thing, it takes up so much storage. But I'm calling it a night. I've now gotten to where I'm on the second set of flashcards that I have. Dude, I look busted. It is almost 11 o'clock. It's literally 2 minutes to 11, and I want to get this up before tomorrow, which I doubt it. By the time it loads and like processes and all that bullshit, it's gonna be the next day. But at least it won't be late into the next day. I also need sleep because I'm having like friends Christmas tomorrow, and I want to be able to function and like hang out and also do more of this like bullshit in the morning. But thank you for watching. If you liked this, hit the like button. If you want to see more videos like this, and other videos, because I do a lot of my different things on my channel, hit the subscribe button, and when you get to the notification bell, press all so you can get notified about all of my videos. But yeah, thank you for watching, and
I will be posting every single day up until Christmas, and I'll be vlogging on a vlog on Christmas. Obviously it'll come out later in the day because like the first half of it is going to be with my family, and then there'll be a haul and everything within that one video, and it'll be up on the 25th. And then I think we're doing a New Year's party, but I'm not really sure. We haven't really got the everything like planned out. But if we do, I'll do a video about that. But yeah, there'll be some book videos on here too, because I know that some of y'all are little book grumblings like me. So, yep, thank you for watching, and I'll see you the next time. Bye.